Good morning, everybody. They say a picture is worth 1,000 words, so a 1-minute video should be worth around 1 million. So without further ado, I'll kick us off.
One of the main reasons why I decided to seek help was because my daughter, she had made the comment that she wishes that she can get me all the beer in the world so that way I can be happy.
Well, opioid use started with just taking pills, overtaking pills, and then it became an issue where I was shooting heroin.
Once I noticed dishes piling up, cat litter not necessarily getting changed, laundry getting worn more than once, I realized I had a problem.
I was tired of the lying, the stealing, the cheating, the broken relationship, just the everyday struggle that I was going through. And I just finally gave in and said, I'm ready. Let's do this.
And for my daughter to believe that alcohol brings me more happiness than she does, absolutely tore me apart. And hearing that from her made me realize that I needed to be a responsible parent and change for my daughter.
I no longer have to lie to people, hide things from people.
My goals are to leave this history behind me.
My marriage is better. My health is better. I feel more energy.
I no longer look forward to getting up and getting drunk every morning. And I feel like I'm in control of everything and feel like the world is my limit at this point. It's honestly completely changed my life, and I'm very thankful for the help.
Like, I want to just take that step on becoming normal again. With Pelago, I feel like I have crossed that bridge.
I'm really, really proud of myself now.
So I wanted to kick off with a quick question, and just a show of hands. Who here has had a close family member, a friend, maybe a colleague, go through some kind of substance use challenge of some kind? And just a raise of hands if you have. Okay, so that's easily the majority of people in the room. And my own personal story started in a very similar way, where I had a very close family member, while still in medical training, go through a substance use crisis, completely unbeknownst to us. So given sort of the scale, the prevalence of these issues, the question is, why do we not hear about it further? So maybe kind of scoping the size of the problem. Today there are sort of more than 50 million Americans, roughly 2 in 10 Americans, who have some kind of substance use disorder issue. That is, that they meet the diagnostic criteria for having a substance use disorder, whether it's an alcohol use disorder, an opioid use disorder, stimulants, cannabis, nicotine, etc. The real challenge is that fewer than 10% of them actually receive the treatment that they need. Or put another way, the tragedy is that 90% of people with a substance use disorder today are not getting treatment. Imagine any other area, any other chronic condition, whether it's cancer, MSK, diabetes, fertility issues, where more than 90% of people were just unable to access the treatment that they need. This turns out to be a huge tax on the healthcare system, including employers, because the vast majority of people with a substance use disorder, more than 70%, are actually in the workforce today. And we know that kicking the can down the road for any type of chronic condition can be incredibly expensive. The question is, how expensive? So the Business Group on Health published their annual report on chronic condition costs. And what they found was that cancer had overtaken MSK as the single biggest driver, or the single biggest disease category overall, the number one across the vast majority of employers. And I'm sure in your own sort of annual benefits review and claims analysis, this is something that has cropped up for many of the employers here today. Imagine there was a way to have a targeted precision treatment that could tackle 40% of cancers with a very fast return on investment. And that's exactly what you find with a substance use disorder, because it turns out that 40% of cancers are actually driven by substance use disorders, which often catches people by surprise. And it was actually the very reason that the Surgeon General at the start of the year published a healthcare advisory linking alcohol specifically to cancer. We've known about the risks of nicotine in cancer for a very long time, which continues to be the single largest cause of cancer here in the US. But alcohol became the third largest cause of cancer, followed only by nicotine and obesity. So those costs extend well beyond just cancer as well. It turns out that SUD, substance use disorders, have a huge multiplicative effect on other chronic condition categories as well. If you look across cardiovascular spend, MSK spend, diabetes, pulmonary spend, it turns out that those who aren't in treatment, the 90% of people who aren't in treatment today, typically find it difficult to also control other chronic conditions. So more than half of people with a substance use disorder will have a co-occurring condition. And as a result, they're not necessarily going to be the folks that are taking their medication, that are engaging in treatment. And you have this huge multiplier effect where their overall baseline costs are often 3 to 4 times higher than those without a substance use disorder, even with those chronic conditions as well. So these are very real hard costs. And the question, often that folks have is, if it's so prevalent, if 2 in 10 people have it, if the costs are so significant, then why do we not hear more about this? And that's exactly what we set out to examine as part of the Pelago annual trends report. Why do employees often not feel sort of comfortable asking for help? So the first question we asked is, how important in the stack ranking of overall benefits is it to even offer some kind of benefit for people who are going through alcohol or drug use? And where would you put it on the overall spectrum? And the results were completely fascinating. So, it turned out that 56% of employees actually said that they consider some kind of access to a program critical, or they felt that they didn't have access to a program today, often because of just the availability of providers, either for themselves or for a loved one, often somebody on the medical plan itself. Yet only 14%, and this was maybe the most surprising fact, actually reported access to a benefit of this kind. So naturally that got us thinking, okay, why is there such a delta between those who would like a benefit in this category and those who are actually receiving access to some kind of benefit? And it turned out that it wasn't simply just an access problem, it wasn't just a network issue, it wasn't even an affordability or cost issue. Those things are absolutely important drivers of engagement and utilization in programs like this, but the single biggest factor was stigma. In short, substance use disorders today, whether you have an alcohol addiction or an opioid addiction, rank as the single most stigmatized chronic condition that people face, ahead of diabetes, ahead of cardiovascular events, ahead of even mental health, and according to this survey, ahead of even financial difficulties. And the reason is simple. People often feel fear of repercussions, they feel fear of losing their jobs, and there's an enormous amount of shame when it comes to admitting to some kind of issue and being able to actually speak about it. And it's no wonder why these issues are underreported and underdiagnosed. So Pelago is a solution dedicated to substance use management. So we partner with large self-insured employers and payers, such as yourselves, to really engage people early across the spectrum of care in multiple substance use disorders. So the way we partner is typically with self-insured employers who are really looking to find an ROI in their medical claims and actually reduce some of these chronic condition categories that we know to be incredibly expensive. And we partner across the entire continuum of care, from prevention through to treatment, across multiple substances, from nicotine to alcohol, to opioids, to cannabis. And it's a clinical model, so it involves engaging people in counseling and coaching in conjunction with access to providers, medication management, and a digital journey itself. We're available in all 50 states. We partner from everyone with employers from Fortune 10 all the way to a few thousand lives by delivering a multidisciplinary approach. And the unique aspect of it is we also guarantee an ROI in the first year based on actual claims data. So we've demonstrated, as I'll speak about in a moment, that there are real net savings to be had within the first 12 months of program deployment. But the real question is, let's say you want to do something about this, how do you even engage the 90%? That is sort of the fundamental question that we get from our clients today. This is an incredibly stigmatized group. Often employers will have, for good reason, zero tolerance policies when it comes to substance use disorders. They might be in a safety conscious environment. So it becomes both incredibly important, but also incredibly difficult to actually identify who those people are and engage them in care. And at Pelago, we've developed a 3-step methodology for doing so. And it really comes down to understanding both the mindset and the acuity of an individual. How ready are they to change? And then where are they in the spectrum of care? So we've developed a unique communications plan that involves, sorry, my hay fever this time of the year is particularly challenging. But we've developed a 3-step methodology that involves a communication strategy really designed to engage people as they start to contemplate care. So we use this framework called the 5 stages of change, and it's really around targeting people who are at the contemplation, preparation, or action stage, which is actually 70% of people struggling with some kind of addiction today. They know they want help, they recognize that they have an issue, but they almost don't understand exactly where to start. So really appealing to people as they are having those golden moments of motivation, as they're starting to consider whether it's because of the new year or another life event that they actually do need support in some kind of program. We've developed a stigma-reducing, targeted approach that can really help identify those people very easily. From there, it really comes down to actually providing, I wouldn't even say fast, but immediate access to multidisciplinary care. So we know that when people have these golden moments of motivation, just engaging them in that very moment becomes incredibly important. If you're going to wait 6 to 8 weeks, you're going to lose that individual. They're more likely to have a lapse. There's going to be something that changes with their level of motivation or even a life event. And what we found is providing same-day access on average at Pelago. It's within 4.5 hours to a qualified clinician to actually engage in care is incredibly effective in capturing those people when the motivation is at its highest. The goal there is ensuring that a qualified professional, a licensed drug and alcohol counselor typically, is actually able to complete a holistic assessment of that individual and understand their acuity level and where they fall on the spectrum of care from prevention through to treatment. And then we'll put them in one of 3 care pathways: support, manage, or treat, depending on their level of intensity or the willingness to actually engage in the program. And then from there, it really comes down to matching them to personalized treatment, specifically access to a multidisciplinary team, including coaches, counselors, nurses, and providers who are able to actually prescribe medication that we're also able to fulfill ourselves. We give people access to remote monitoring devices, so they're able to track their sort of outcomes and their progress in real time. That's all in conjunction with a digital cognitive behavioral therapy program that's actually engaging them across the care pathway. And really the one takeaway is different mindsets and different acuities require a highly personalized approach. So it's one thing to identify those people, then it's another thing, of course, to actually engage them in care that's actually personalized to them versus a one-size-fits-all approach. So I'll end on this slide because I feel, or actually I have one more slide, but I'll end with this sort of major slide because this is often pretty important to employers, particularly in the current sort of economic environment when it comes to actually making a business case. We, as leaders in HR and benefits, typically want to do the right thing. We want to actually provide people with access to the programs that we know are going to help them and their loved ones. But how do we justify it from a business case perspective? So the CDC actually did some incredible work just a year ago where they looked at 162 million Americans in the workforce, specifically at the claims and the cost of substance use disorder treatment, cost of substance use disorders that are untreated today. And they quantified that the overall cost was roughly $15,000 above baseline for people who aren't in treatment for substance use disorder care. So that's a really important number to remember. $15,000 is the average incremental cost that you, as an employer, will be paying for people who aren't actually accessing treatment. Across hundreds of customers, we then aggregated the claims data to look at the impact the Pelago program had just 12 months into deployment. And what we found was that we were able to reduce roughly half of that cost. So $6,758 was the savings per participant based on actual claims data. So this was as a reduction of inpatient spend, outpatient spend, emergency room visits, RX spend as well. We actually saw a 31% decrease in inpatient admissions relative to a matched control, which were people who were receiving treatment for their substance use disorder from the health plan. So that's all to say it actually does come with an incredible ROI, a 4.5 to 1 ROI in the first year. And that's unsurprising because you're really getting people who aren't engaging in conventional care today and delivering early access to care. So do you have a gap in substance use disorder care? If there's really 4 key takeaways I'd like to end on, it's the fact that when you're considering a program, if you have an overall behavioral health strategy, thinking about what the SUD component of that behavioral health strategy looks like is incredibly important. Many employers, I imagine, in this room have probably invested significantly in better mental health benefits over the last few years, and that is very important when it comes to productivity and burnout. But substance use disorders and mental health aren't the same. So really understanding how to offer specialized treatment becomes the most important part of that strategy. Understanding how SUD is driving chronic condition categories that you may be focused on from an annual review perspective in actually reducing also becomes important. You'll see these sort of common chronic condition categories in your claims report, whether it's cancer, diabetes, or GI. The question is, how do we actually go about reducing them with a holistic approach? And then, how do you actually engage people in care if you choose to offer a benefit like that? And as much as I would like to say there's a silver bullet over here, or it simply comes down to partnering with us, this really comes down to leadership buy-in and advocacy. It comes down to having a conversation and recognizing that this is a chronic condition, it's not a moral failing, and there are programs available that are confidential, anonymous, and safe for people to access. And then finally, it really comes down to proactively communicating with your employees about the different treatment options and avoiding a one-size-fits-all approach. So thanks all for listening, and enjoy the rest of your day.